Testing, testing.
Recording in progress.
Testing, testing. 1, 2, 3. All right, hello everyone. Where are we coming in from today? Thank you for spending this morning with us. We have Dr. Sheng live in our studio today. We're very honored to have him here with us. San Pedro, San Francisco, Santa Rosa, Santa Cruz, a lot of California, Escondido. Awesome. Well, let's get started today and welcome everyone to today's class where we will be discussing the comprehensive care strategies for your cancer patients, combining the best of traditional Chinese medicine and Western approaches. Together, let's uncover new pathways to healing. My name is Myra Chen, and I'm your host and moderator for today's webinar. Here at eLotus, we have been hosting educational courses for over 3 decades, and we are proud to be your trusted source for premium CEU content with over 200 speakers, 900 courses, and 3,000 hours of CE. We really appreciate you all here for being here with us today. Allow me to introduce you today's speaker, Dr. Peter Sheng. Dr. Sheng is a Cincinnati acupuncturist and holistic medical doctor trained as an internist, hematologist, and cancer care specialist. Named Best Doctor by the Cincinnati Magazine and Cindy Magazine, Dr. Sheng is a respected and beloved physician who provides exceptional integrative medical care, combining both traditional Chinese medicine with conventional Western medical care. How many of you find it challenging to manage symptoms in cancer patients? Could you type yes if you do in the chat room if you find it challenging? A lot of yeses. Well, you're in luck. And today's webinar, Helping Cancer Patients Live Longer and Healthier, Master Lessons of over 40 years, is sponsored by Evergreen Herbs. Our expert today is Dr. Peter Sheng, a rare clinician with over 40 years of clinical experience, bridging oncology with traditional Chinese medicine. Dr. Sheng will walk us through how he approaches some of the most complex and challenging cancer cases in clinical practice, including breast cancer, lung cancer, colorectal cancer, oncometabolic syndrome, hematological malignancies, hepatocellular carcinoma, pancreatic cancer, esophageal cancer, and prostate cancer. This is not a theoretical overview. This is going to be a practical, clinically grounded look at how Western medicine and TCM can work together to truly support cancer patients and survivors. You will learn how to integrate acupuncture, Chinese herbs, and dietary guidance alongside mainstream oncology treatments, how to navigate the latest advances in Western cancer care, and how to bring meaningful relief to patients at every stage of their journey. By the end of today's class, you will walk away with real, applicable strategies to elevate your integrative oncology practice, and most importantly, to better support the patients who need it most. If you'd like to dive in deeper into oncology, I highly recommend checking out Dr. Sheng's additional courses on his speaker page, as well as courses from other notable speakers, including Dr. Shihong Luo, Dr. Fu Liao, Dr. Jonathan La, and many more amazing practitioners. And coincidentally, we have another webinar coming up shortly with Dr. Noel Potash on cannabis for oncology patients on August 3rd. And I'll put all the links for you in the chat room so you can learn more. And lastly, a quick reminder for any new attendees joining us today. Please make sure to set your chat from hosts and panelists to everyone so we can all be part of the conversation. To submit questions during the presentation, please use the Q&A box so they remain organized and easy for us to answer. And if you're here live and can both see the chat room and hear the presentation, your attendance is already being tracked, so just be sure to stay until the end of the webinar to qualify for the CU quiz. A notification with directions will be sent to the email associated with your eLotus account when the quiz is available on Monday. And now let's get started with today's webinar, and please join me in welcoming Dr. Peter Sheng.
Okay. Thanks a lot for Mara for the introduction. I also want to thank eLotus for providing this platform for continuing education for acupuncturists and the TCM practitioners and give me the opportunity to share my experience. Let me reintroduce myself a little bit. I wouldn't say I'm the only one in the United States, but I'm sure I represent a very small group of people. I'm a board certified internal medicine and hematology oncology. I did a private practice and then I went back to hospital, work on a part-time basis as a medical oncologist, where my job is mostly to supervise young doctor in trainee. In other words, the oncology fellowship program at the University of Cincinnati. I work primarily at a veterans hospital. Up to this date, even I've officially retired a year ago, I still work there on a part-time basis, probably 20 to 30 hours a week, simply because there are not enough doctors working there. However, in addition to my Western medicine practice, I've been a TCM practitioner. Not that only I learned acupuncture, I studied Chinese herbal medicine, I practiced. So 2008, I closed my Western medicine medical oncology practice. And the reason for that is really because the practice environment at that time in Cincinnati, there were several large groups, and I became the last solo practitioner, and I knew I could not continue because there nobody practiced for me if I were to go away, if something happened to me. So I said, okay, I just closed my practice, and what I'm going to do with my office as I had learned acupuncture in the early 90s, and I've all along been doing acupuncture. I started doing more acupuncture and more Chinese herbs. And till the time I retired a year ago, I probably have treated 90,000 times total number of visits acupuncture, which may not be a whole lot, but in Midwest, that's a pretty significant number. So I do have a real world experience treating a number of people, including a lot of cancer patients. Of course, my TCM practice was not limited just to cancer patient. I really treat a whole variety of other things. And then from working in Western medicine, I've also witnessed firsthand the change in oncology in cancer treatment in recent years. There has been significant progress made. And simply put, there are more and better treatments, and the outcome is significantly better. And I'm glad I did not quit oncology earlier. I'm still in the field, and I can see indeed our patients living longer and better. So, of course, today I will provide a very different perspective. I still work in the hospital, work in an oncology clinic, and most of the patients are treated with Western medicine only without Chinese medicine. However, in my own practice, I provided acupuncture and sometimes herbs to try to help them cope with symptoms, live better, and maybe longer. So that's a kind of a background. The content of the webinar, I really want to mention from time to time the changing landscape of oncology practice in Western medicine. Because of rapid change, TCM practitioner's role is also changing. I remember very interesting, not just for cancer patients. At a hospital's dinner program, I was sitting next to a retired infectious disease specialist, and he said something very interesting, and that also is very true for TCM practitioner. He said that when he was in training, when he was a younger physician, he learned about several different types of hepatitis B, hepatitis infection. And once there's available, there's advent of effective antiviral medication, none of the prior classification matter anymore. And the same thing is probably true for TCM. I remember 20, 30 years ago when I was learning Chinese medicine, I spent a lot of time studying how to treat liver cancer, how to treat hepatitis. And that has to change now because when the treatment become more effective in Western medicine, our road changes because their outcomes getting better. And when they respond to Western treatment medicine, a lot of disease manifestation also disappear too. I will touch a little bit on lifestyle medicine over and over again in my presentation. I have a special section devoted just to cancer nutrition. No matter what kind of practitioner you are, TCM, chiropractor, or a naturopath, nutrition is very important. However, as a medical doctor, I know I had very little training when I was in school, and there's very little training for young doctors nowadays in school, in residency, and in fellowship training. Exercise, there is some exciting data. Relaxation meditation, I will briefly touch on some supplements. You're welcome to ask questions, but that's really beyond the scope of this discussion. Then I will dive into different tumor types. It's not possible to cover every tumor types. However, I would just say that the general principles in TCM really apply to just about every tumor type. The general principles is what matter rather than any special herb or special formulas for any special type of cancer from TCM perspective. I don't think we are there yet. We need more research data. I will, of course, also touch on basic cell biology, a little bit of genetics and epidemiology. So hopefully you will have a better understanding of tumor biology, understand your TCM practitioner. However, this part is also important for your understanding where the field is moving toward. We do more and more in Western medicine, so-called next generation sequencing, or in short, NGS and oncogenes. So simply put, in Western medicine, since around 2010, there's a term called a personalized medicine. However, strictly speaking, for Western medicine practitioners, oncologists, personalized medicine really means doing a genetic analysis to find in each person's cancer, can we find any special gene mutation, and whether this mutation is meaningful and it drives the cancer cell growth. In other words, whether it's a driver mutation. And if there is a driver mutation identified, whether there's a corresponding inhibitor. A lot of our, we call it TKI, tyrosine kinase inhibitor, and that blocks the, the cancer growth, and the patient responds dramatically, not necessarily in terms of cure, but in terms of prolonged cancer remission, duration, and better quality of life. And in recent years, there's also a lot of talk about immunotherapy. There's a really breakthrough, and since probably 10, maybe 15 years ago, the immunotherapy first appears and it's been applied to a whole variety of types of tumor types. And I've seen dramatic responses. You probably have heard about PD-1, PD-L1 antibody, and then there's bispecific antibody, drug antibody conjugates, CAR T. They're effective to some extent, and we still do not quite understand why some people respond and others do not. However, it is definitely true that there are long-term survivors. For instance, stage 4 lung cancer, which means cancer is already in the advanced stage, with spread to other organs from the lung to the adrenal gland to the bones to the liver, with a combination of chemotherapy and immunotherapy. There's now 5-year 20% survivors, which is almost unheard of when I was younger, say 20 years ago. At that time, stage 4 lung cancer patient live an average 8 months or 10 months, less than 1 year for sure. And there are more and more drugs being developed, being approved, and they're truly making a difference. So you might have heard of this. This is from 2 Nobel Prize winners, Robert Weinberg and Doug Hanahan. In year 2000, they wrote published an article, I think, in Nature, called the hallmarks of cancer. So there are quite a few things. How cancer cells are different from normal cells. I know we can start with this kind of resisting cell death. With any injury or trauma or external stress, a normal cell will either repair the damage or proceed to death pathway, either called apoptosis or necrosis or autophagy. In other words, if the cells think that the damage is beyond repair, the cells will start killing itself. However, cancer cells have evolved the ability to resist the cell death. In the medical term, we call it anti-apoptosis. And cancer cells also have different cellular mechanism, metabolism. The most striking thing is this. Cancer cells almost utilize sugar exclusively as energy source. And the normal cell is very flexible, adaptable, the plasticity, and normal cell can utilize fat and sugar and even burn protein. The exception is some cancer cells use glutamine. So glutamine supplement, too much glutamine, not necessarily a good thing, because many cancer cells can utilize amino acid glutamine as an energy source. But the difference in cellular metabolism between cancer cell and normal cell could be utilized for treatment strategy and also medications. Cancer cells also have sustained proliferative signaling. They will continue to proliferate, and they will evade growth suppressors. Normally, we have two sets of genes or proteins in a single cell. One is pro-growth, and the other is anti-growth. There are genes that stimulate the growth. It's likened to like the accelerator in your car. On the other hand, we have some tumor suppressor gene, which will suppress or tumor growth is likened to like a brake in your car. And a normal cell have to have some kind of balance between the two systems. If a cell is always with the feet on the accelerator pedal, the car will continue to go on without stopping, and that's continued growth, and that will become a problem. And then we talk about this avoiding immune destruction, and the new breakthrough I just mentioned briefly, anti-PD-L1, PD-1. PD-1 and PD-L1 are PD-1 and PD-L1 are short for programmed S. These are proteins sticking out on the cancer cell and also the lymphocytes. So in normal circumstances, they keep the immune cells away from the cancer cells. Researchers have been working on immune system treating cancer for many decades. However, there was not a whole lot of success years ago until scientists figure out there are proteins called the ligands on the cell surface, and between the cancer cells and the lymphocyte, like the T lymphocyte, cytotoxic lymphocyte, part of our immune system. So they came up with an antibody to destroy this protein called PD-1 or PD-L1, and to allow cytotoxic T lymphocyte to approach to get near the cancer cell and kill the cancer cells. So under normal circumstances, cancer cell can evade immune destruction. However, with modern day immune therapy, we have made a quantum leap in our outcome. Not necessarily curing everybody or have a huge response, but like I said, many people do respond much better and live longer. And then we have this enabling replicative immortality. In other words, there's a cell cycle under normal circumstances. There's you probably heard it before, S phase, G1, G2 mitotic phase. And there are protein regulating the cell cycle. When does the cell begin to synthesize DNA for the replication, and when does it stop? There are a lot of regulation, and cancer cells are able to change the cell cycle regulation. And there are correspondingly pharmaceutically some cell cycle regulator like a CDK4/6, those kind of things in breast cancer. And then tumor also provokes inflammation. Having a cancer is an inflammatory condition. That's why anti-inflammation is very important. Whether it's a curcumin, quercetin, or a lot of Chinese herbs, they'll all possess anti-inflammatory properties. So anti-inflammation is very important. And having tumor is an inflammatory condition because the tumor cells itself can secrete a lot of inflammatory molecules. And the tumor cells also call his friends, form again, some like myeloid, the derived suppressor cells. And they also secrete a lot of inflammatory molecules like interleukin-6, interleukin-15. And together they produce the inflammatory environment. And tumor cells like and thrives in the inflammatory environment. And then we have this activating invasion metastasis. Cancer cells are able to spread and invade. And also vasculature, you heard of angiogenesis, which means formation of the blood vessel. For a tumor cell colony to grow rapidly, it will outgrow its normal blood supply very rapidly. So tumor cells also have ability to stimulate blood vessel growth, to invite the blood vessel capillaries to grow into a tumor. And there are a lot of herbs and also pharmaceutical drug that inhibit the process called anti-angiogenesis. And then genomic instability mutations. A few years ago, they updated their discovery and they come up with more things. phenotypic plasticity. Under survival pressure, one tumor type can transform to a different tumor type. For instance, when we're treating prostate cancer, we give them hormone therapy, chemotherapy, some other treatment, and a small percentage of patients may transform from prostate cancer, adenocarcinoma to small cell cancer clinically. And epigenetic reprogrammation. On top of the gene, there's another layer of control called the epigenetic. This is not quite well understood, but it's important in cancer development and also cancer treatment. There are some limited options called epigenetic therapy available clinically. And then more and more, we talk about the microbiome, importance of the gut mycobacteria. I will touch on that. This is an important thing. And senescent cells. Some cells become old, but then they don't die. So understanding cancer biology, modern oncology rely heavily on genomic gene mutations, major growth cellular pathways. These are our pathways we used when we were in fetus, in mother's womb, and baby, toddler, or throughout adolescence. So once we become adult, we don't need this growth pathway anymore because we reach a certain number of maturity. We have a fixed number of tumors, normal cells in each organ. We don't grow a whole lot anymore other than blood cells, hair, skin, lining of the intestinal tract. So continued growth once we reach the adult phase means trouble. That's either aging too rapidly or cancer. We probably have about 14 major pathways, each comprising multiple steps and enzymes. And if one mutated gene falls on one of the pathway, which may consist of 3 or 4 or 5 genes or even more, the end result is accelerated growth. And there are pharmaceutical companies together with scientists, scientific research, they have developed a lot of inhibitors inhibiting one of the mutated genes product called the tyrosine kinase inhibitors. However, I often ask my trainee, young doctors in oncology training, with all the genomic medicine, with all the hype, with all the news media coverage, how many patients truly benefit from genetic analysis? As of now, the dramatic response is probably 10%, maybe a little more. Certainly, the story is evolving, and I'm sure in the years to come, we're going to have more discovery, better drugs for for mutations that we're not able to block or inhibit in the past. A lot of time, tumor have a lot of mutations, but we don't know whether they're just driver mutation, meaning they're significant driving tumor cell growth, or whether they're innocent bystanders of unknown significance. Not infrequently, we send a piece of tumor tissue to a company, either Foundation One or Caris. There are quite a few of those company platforms that perform gene analysis, and they send a report back. My young trainee asked me, what's the significance of this mutation? My answer is, I don't know. We don't have enough data to answer that question. So we see a lot of mutations, and the more you check, the more you test, the more mutation you're going to find. So another layer of control I mentioned briefly is epigenetics, controlling gene expression. That's poorly understood. But we do know that a healthy lifestyle helps a good epigenetic. If we only rely on gene mutation for a species to become better, the so-called Darwin theory, we as a species, a human being, may face extinction if some disaster hit. And in other words, the mutation happened randomly, and the best mutation will stay. The bad mutation actually is a negative. However, when disaster hits, for instance, severe weather change, famine, or even epidemic, we have to be able to adapt very quickly, and our genes will have to change. So we can not only rely on gene mutation, we have to rely on a top layer on top of the gene, which also sense the environmental changes. And that's called epigenetic. Simply put, those people who smoke, female who smoke during pregnancy, their children are affected, and their offspring, their grandchildren, also affected. And that's not through mutation. That's just some epigenetic changes, but it may be carried on for generations. Growth pathway from developmental stage, like as I said, fetus, infant, adolescent, and they started growing uncontrollably when they should not grow that rapidly or should not grow at all. So just to introduce one thing, this is Easter Island. This is in the Pacific Ocean, and you probably heard or seen this photograph. There's a giant statue, either head and torso made of stone on the near the shoreline. So there's an interesting story. There's a drug by the name of rapamycin, and Easter Island, the local people call it Rapa Nui. So the drug rapamycin is named after the island Rapa Nui. And by the way, the Eastern Island was named because the Dutch explorer discovered the island on Easter Day. So that's why named the Easter Island. So rapamycin, it's isolated from the soil from the island, and that originally as an antifungal drug, later find that its way to be an immune suppressant agent. So for instance, people who underwent organ transplant, they need some kind of immune suppressive drug to stop rejection, to avoid organ rejection, to take the medicine. And the function of the rapamycin is to inhibit this growth pathway called the PI3K, AKT, and mTOR. And rapamycin inhibits the mTOR function. So mTOR means mammalian target of rapamycin. And this is discovered from this island. And again, this pathway, PI3 kinase, AKT, mTOR, is active or upregulated, the medical terminology, in at least 50% of the cancer types. So if you're able to inhibit the pathway, you will slow down the tumor cell growth. And there's a natural way to do that. For instance, prolonged fasting can also slow down mTOR, because whenever energy, i.e., be that the sugar or protein or fat comes in, the mTOR will be upregulated because mTOR is for growth. So how to decrease the mTOR activity? Fasting. If you lower the insulin level, the mTOR will be inactive. A drug called metformin, which is really anti-diabetic drug, has been around for 60 years. I do take it myself, and I don't have diabetes, but metformin could lower insulin level and lower the mTOR activity. And there are also more potent drugs like sirolimus, which is also inhibits the immune system. And lately, there's a report that low-dose aspirin may inhibit a related gene and a protein along the pathway called PI3 kinase. And I've been telling people with a history of colorectal cancer to take a low-dose aspirin for many, many years. And it turned out that not everybody may benefit the same. However, those who harbors the PI3K mutation do benefit from low-dose aspirin. And I've been taking that for probably 40, 50 years too. 80 milligram a day. There is some limited evidence, weak evidence that the low-dose aspirin may decrease the risk of colorectal cancer and breast cancer. Okay, talking about the pathway, there's another one. You probably read the news at the beginning of last month. There's a annual oncology meeting called ASCO, standing for Annual Society, American Society of Clinical Oncology. Every year, about more than 40,000 oncologists worldwide meet in Chicago. And this year, the highlight is there's a new drug that inhibits a oncogene or a pathway called a KRAS. The RAS standing for rat sarcoma virus. Originally, a virus, but that become part of us. So the RAS is become a growth stimulator or part of the growth pathway. And in pancreatic cancer, which is very difficult to treat, about 90% or higher the patients with pancreatic cancer have KRAS mutation. And the drug company finally came up with a drug that inhibits the KRAS. And it's very effective. And people, after they fail the first-line therapy, live about 13 months. Now, 13 months may not be a whole lot for some of you, but those of you who work in the cancer field, those of you who treat pancreatic cancer, this is very exciting. Because even with frontline therapy, the research clinical trial shows that they live less than average for a year. So having talked about pathway, now it sounds all good. However, there's a pathway and there are pathways. I went to a scientific session a long time ago. There's a Italian oncologist who specialized in lung cancer, name is Scagliani, who put this slides up, and I got idea from him. And he said that in Buffalo, New York, there's one subway, and there's only one line. So if there's anything happen to any of the stop or any along the path, the whole pathway is blocked. However, if you ever go to New York City and you know how complicated the subway map is, and I remember I was there 20 some years ago, and it was a Sunday, was underground trying to get on certain line, and then there's a broadcast say this line doesn't run on Sunday. You have to go to different level, different platform, and ride another line. And I was at a total loss. But I just follow the crowd and get to there. So what I'm trying to say is, in cancer cells, if you block one pathway, sooner or later, cancer cells will find another way to reconnect. If you block one pathway, they can find the bypass, continue to activate cell growth. And this is why, as good as the genomic medicine, the inhibitors, we're not curing more people, but we're able to control the disease for a longer period of time. So what about TCM practitioners? I firmly believe that we play a supporting cast most of the time now because Western medicine is becoming more and more effective. There are more and better drugs. I believe in integration, only with limited exceptional scenarios. We may use TCM or alternative medicine as the only mode of therapy. For instance, patient 2 week, not candidate for treatment. And I think we need to focus on the basics, improve patient's sleep, appetite, how to help people relax, and improve the immune functioning. Okay. Okay, I firmly believe that TCM practitioners are playing a supporting role. We need to talk about integration, not just alternative medicine, not being alternative, except there are rare scenarios, patient exhausted treatment options, patient firmly decline chemotherapy or mainstream medicine. We focus on the basics, make people sleep better, improve their appetite, digestive function, relaxation, strengthen the immune system, alleviate treatment-related side effects. And it's a balance between attacking and nurturing, and that is exactly what's missing in Western medicine, where they only attack the cancer cells, but they do very little nurturing the host. And be aware of the positive studies. We do need more data, how to integrate TCM with Western medicine. And in my presentations that follows, I will make a reference to Taiwan's National Health Data Registry. People in Taiwan are lucky that for the last 30 some years, there has been national health for very, very little money or copay. They enjoy excellent healthcare. It's a very unique environment because Taiwan is a relatively small island, densely populated. There are many large hospitals. The hospital there have easily 3,000 hospital beds. They may have, 1,000 operation a day, and the people don't have to travel very far, very long. They can go to see the top doctors in the country, in the island, in the country. And then they also have a very good data registry in the computer system. So for researchers to mine the data, they can go into the database and ask a question. For instance, a breast cancer patient between 2001 and 2010, how many use Western medicine only, and how many use Western medicine and the TCM the same time, and what is the outcome? Because TCM, Chinese herbs, also paid by the national health, and that's why they're data. If you go out of the national health system and you see some doctor on your own and you pay out of pocket, nobody will ever know, how many people are doing that, and that's why we're not able to track people very well in this country, because they pay outside of the the health insurance doesn't cover a lot of Chinese herbs. So this is probably the best way to get some data as to how TCM add to the outcome, whether it's overall survival, disease-free survival, response rate, quality of life, this kind of thing. So I do want to mention, so far since I have talked a lot about the Western medicine, but I do want to say something. So this is a 90-year-old locally advanced squamous cell cancer for the skin. There are more and more skin cancers we see in recent years, very aggressive skin cancer too, probably because the people get older, their immune system is not as good. So this gentleman came very weak. He had localized squamous cell cancer of the skin involving the cheek. It has not spread to elsewhere in the body. However, because of the pain from the cancer, he was not able to chew, to eat. As a result, he lost weight and was very tired. And we had a discussion and gave him immunotherapy called a cemiplimab, and just one dose. Came back 3 weeks later, walked into the clinic, gaining strength and gaining weight. Gaining strength and gaining weight, because then the tumor totally disappeared. And I've never seen that before in my life. And this is what immune therapy could do. So our strengths and our weakness, comparing the Western medicine to TCM, Western medicine has accurate diagnosis, but TCM, we're very limited by our full examination, taking questions, looking at the facial complexion, and the tongue and pulse diagnosis. There are some respectable TCM practitioners in the United States in the past so many years. There's a Dr. Ni, N.I., who is from Taiwan, but passed probably 14 years ago. He's very great, and up to this day, he still has a lot of teaching posted free on YouTube. But he always tell people, don't do examination, don't do biopsy. And as a cancer doctor, I will tell you that the gold standard is still biopsy and the pathological diagnosis. In the old days in Chinese literature, there are a lot of description of probably nowadays cancer, They use the scripton like a rock called a yin, like a cauliflower shape of a tumor or growth. But without biopsy, we don't know what type of cancer we're talking about, and we don't know whether that could be infection either. So Western medicine, scientific progress, and the TCM is more, we call it in Chinese, Sheng, kind of metaphysics. We're based on invisible, intangible thing. We talk about the qi and talk about the blood, talk about the meridians. And in Western medicine, making progress rapidly. So we're looking forward. In a few years, we probably will have a better treatment for disease we're not able to treat effectively now. However, interestingly, actually, I heard this from Myra's grandfather, who was a experienced, respectable Chinese medicine practitioner. He said that in Chinese medicine, we look backward. So what does that mean? The basic foundation was laid down 2,500 years ago, the Huangdi Neijing, 1,800 years ago, the Sheng Lun. Up to this day in TCM college, people still study those, those books, there are courses taught. And then we're still trying to interpret what the ancient Chinese were trying to tell us. So there's nothing new in terms of theory in Chinese medicine anymore. We're just trying to figure out how to best utilize ancient people's teaching to modern day disease. The problem with Western medicine is it's very expensive. I don't need to go into that. And Chinese medicine is very cost effective. Already mentioned that in Western medicine, we only attack and there's no nurturing. And we really need more nurturing, more boosting, boosting the energy, boosting immune system, and relaxation. So another level of holistic and personalized medicine is TCM practice. In the eye of TCM practitioner, everybody is a different individual. So with the same diagnosis like breast cancer, lung cancer, there are different subtypes of body condition, how the body cope with the stress, and how the body cope with stress from treatment. So Western medicine has clear mechanism of action. What the TCM, well, we cannot explain, and that's one of the hurdle facing us. Patient asking, what exactly will this do? Sometimes very hard to explain. And Western medicine is based on large database statistical analysis, and we know this treatment is good, this treatment A is better than treatment B, or today's treatment is better than treatment from 5 or 10 years ago. So based on studies, many patients, N of many, Chinese medicine still rely a lot on anecdotal evidence, N of 1. And I would say here that the anecdote does not count in medicine because all the anecdotes really dive into it. They may be taking other forms of therapy. You don't have a long enough follow-up. You don't have verification of the pathology, the real cancer diagnosis. So Western medicine does prolong life, and TCM more focusing on quality life. However, I will tell you later that according to Taiwan's National Health Data Registry database, a lot of time, a lot of tumor types, when patients incorporate TCM into Western medicine practice treatment, they live longer. That's retrospective data, but it's very large sample size. Okay, so they talk about translation, and for all of us to think about how do we translate the TCM research to clinical. Ultimately, we need to improve our clinical practice. And I will mention later, there's a herbal formula. A Yale professor, Dr. Chen, who's from Taiwan too, has spent the past 27 years studying 4-drug combination under the name of PHY-906. And he's done basic research from the cancer cell line in the laboratory, animal study, and then human phase 1, phase 2, phase 3 study. And that's a prime example of translation from science to bedside. So having said, since that all talk about Western medicine, then what about Eastern medicine? What about TCM? We do have certain strengths that Western medicine doesn't know at all. So here I say, don't throw away the baby with the best water. The yin and yang is our basic. For many years, I thought I could stay away from using yin and yang to explain how Chinese medicine works. Just using like autonomic nervous system, the sympathetic system is likened to the yang, the parasympathetic is like the yin. However, that's oversimplified version. So this is a patient with ovarian cancer stage 4. Actually, she was referred to me by GYN oncologist in Cincinnati. The time she came to me, she already failed 2 lines of therapy. I very rarely see patients at the beginning of their diagnosis. They're busy with Western treatment, maybe surgery, recovery, dealing with stress, and taking care of personal matters. So she came with a third sensation, sweating at night, some weight loss, 15 pounds, and not able to gain back, and also sores in the mouth. So the tongue is like this, very dry, very red, beefy red, dark red, no coating. This is the typical yin energy deficiency. So give her some herbs. And then later she had some shoulder problem that didn't get better with physical therapy. So I also offer some acupuncture treatment, not only treat the shoulder. Of course, when I treat the shoulder, I also put needle to try to balance the whole body and treat the cancer. And up to this date, she's alive 2.5 years later and stable. And then I use some initially some yin boosting herbs, and then she keep coming back mentioning the sores in the mouth. So I use the herbal formula called the 知柏地黄丸, 知母黄柏, and added to 六味地黄丸. That's a classic formula. It's been around for 1800 years. And the sores in the mouth got better. And more recently, she told me that she didn't tolerate the herbs as well as she used to. It caused some nausea. The reason is simple. I got another picture of her tongue. The yin deficiency is almost disappeared. So people don't have yin deficiency, don't tolerate yin boosting herbs because it causes more nausea, stomach upset, that kind of thing. Another patient, a friend of mine in Taiwan, a few years ago, actually 5 years ago, diagnosed with stage 4 bladder cancer. Transitional cell is spread to the lymph node in the retroperitoneal area. These are lymph nodes along the abdominal aorta. So at that time, there's no immunotherapy, and Taiwan's health registry did not approve. These drugs are very expensive. So he had conventional chemotherapy. Of course, he had a lot of side effects, but over the phone, I diagnosed him as having kidney yin deficiency, some ankle swelling, frequent urination, and feeling cold. So mailed some yin boosting herbs. He's alive in remission 5 years later. I cannot completely claim credit. However, looking it up, with chemotherapy alone, probably 5-year survival rate, cure rate about 5% or so. Adding the Chinese herbs, he's feeling better and cancer-free. So sidetrack a little bit. This is a patient, even I retired, it's still some of the old patients still came to see me. Talking about the yin and yang, I think yin and yang is probably the most important thing in Chinese medicine. So this is an old patient of mine. I treated her in the past for anxiety. And she's since moved to Florida and still come back to Cincinnati to visit family and friends. And she called me from Florida. She said she was diagnosed with having left-sided hydrocephalus, and that affect her walking. So she came in walking with 2 walking sticks, kind of stooped over, very bad posture, like a humpback. She asked me to treat her. So I asked myself, do I know how to treat the hydrocephalus? Of course I don't. In Western medicine, they would do a shunt, put a shunt, drain the left lateral ventricle in the brain, and the catheter goes to the abdominal cavity, going through the chest wall. But because her other comorbidities, neurosurgeon did not want to do the operation. But interestingly, when I did the quick pulse diagnosis in tongue, this is her tongue, similar to the previous one you just seen. Very red, no coating. yin deficiency. Tongue is kind of small, shrunken. And what's striking is her pulse. In Chinese medicine, there are many different ways to take pulse. You've learned the basic. However, generally speaking, if you apply the yin and yang to the pulse, the right pulse means qi or yin energy, and the left pulse means the blood or yin. So you detect the yin deficiency more from the left pulse. You detect qi or yin deficiency more from the right pulse. And there's a striking difference between the pulse intensity in both wrists, in that the left pulse is very weak and put a little pressure, almost disappear. So she has severe yin energy deficiency. I did not get into how did she get there, but I gave her one acupuncture, some scalp needles, ear extremities, and gave her bottle herbs to boost her yin energy. And she came back a few days later asking for a second acupuncture. She said, I'm feeling so much better. She came in walking straight without walking sticks. Just by balancing the yin and yang, something dramatic happened. And likewise, in cancer patient or in other non-cancer cases, look for the yin and yang discrepancy. So TCM strength is treating the whole. It's more than icing on the cake. It's optimizing microenvironment, treating cancer by not directly treating cancer cells. We're treating the microenvironment, and different parts of the body are closely interconnected. I will delve that into a little more details later, what I mean. And the good news is more oncologists now recommending acupuncture in the United States. Even some admit that they don't understand how it works. For instance, when it comes to peripheral neuropathy from certain drugs, treating myeloma, treating ovarian cancer, treating lung cancer, treating breast cancer. And there are now acupuncturists working in many hospitals under integrative health medicine department. However, herbal medicine is still an uphill battle because it's a multi-ingredients, multiple herbs in the composition, multiple pathway, multiple targets, and the doctors are very concerned about drug-herb interaction. There are more encouraging data, like I said, I will share with you about the retrospective data in large sample size. For all of us to, the challenge is how to do prospective randomized double-blind trials in TCM. There are some small studies in China, okay? Okay, I will move on. I'll talk a little faster because we had a little mechanical problem. So we'll move on to breast cancer. This is the most common female cancer globally, and it's been estimated that 1 out of 8 women in the United States will develop breast cancer in her lifetime. Estimated about 320,000 new cases a year in the United States, and there are 4 million survivors. So I'm sure in your practice you will encounter some breast cancer survivors, perhaps a few undergoing treatment. The annual death is 42,000, so most of the people do survive the diagnosis. And there are genetics, there are genes called oncogene involved in cancer development. The best known are BRCA1 or BRCA2. If one unfortunately harbor one of those genes, the lifetime risk is probably 70 to 80% that they will develop breast cancer. And not only breast cancer, this is the cancer predisposing gene. They're also at risk of a whole variety of other cancer. Female organ like ovarian cancer, maybe 40%, maybe pancreatic cancer, maybe some other tumor types. Basically, BRCA1 and 2 are gene DNA damage repair gene. People have mutated gene, they don't repair the DNA damage when there's a stress. And there are some other less well-known genes of lesser significance, but they probably also play a role, like ATN, PTN, PS3 kinase, AKT1, won't go into details. But I want to emphasize that the so-called cancer family syndrome due to oncogenes accounts for no more than 10% of all the breast cancer cases we see. In other words, the vast majority of cases are due to postnatal factors, i.e. lifestyle, the diet, the stress, the chemicals, carcinogens, the environmental carcinogen, so forth, so on. the microplastics, so forth, so on. Another thing I want to mention is controversy of hormone replacement therapy. There's a very large study, you might want to look it up, called the WHI, stands for the Women's Health Initiative Study. This was stopped around 2005 after about 10 years follow-up. Close to 100,000 women were recruited in the study and randomized to estrogen progesterone versus placebo, because at that time, the prevailing thought was postmenopausal hormone, female hormone, is good for overall health for women. And gynecologists handed out prescriptions like water. They believe that providing estrogen after menopause is like providing the fountain of youth. However, the study shows people who received estrogen replacement therapy had a 20% higher risk of breast cancer. And there's also increased risk of a heart attack and a stroke, and also blood clots. The other good thing about estrogen replacement, fewer cases of fracture, like a hip fracture. So TCM, I'm sure some of you do, or perhaps everybody has treated people with menopausal symptoms. I do too. We could use TCM to treat menopause to help people get off hormonal replacement therapy. Not infrequently, people call me, say, can you help? I say, yeah, take a history. Well, I'm 62. I have been on hormone replacement therapy for 12 years. As an oncologist, I share the data that said, well, long-term use increase your risk of breast cancer. And why do you need a hormone replacement for 12 years? My recommendation, people who have real severe menopausal symptoms, hot flashes, irritability, inability to sleep well, right after menopause, take the hormonal therapy maybe for a year and a half, and then stop. And again, lifestyle matters. Okay, so integrating TCM in breast cancer care, the Western medicine perspective, you need to know that the breast cancer are divided into three types: hormone receptors positive, HER2 positive, and triple negative. So these come to the driver. About more than 50%, perhaps 70, 80% of the patient at time diagnosis are hormone sensitive. In other words, they have a hormone receptor on the cell surface. And another fraction of the patient have the so-called human epidermal growth factor, HER2, receptor positive. They need an anti-HER monoclonal antibody therapy. A third subset called a triple negative, this has the worst prognosis because their treatment up to recent past is primarily conventional chemotherapy. And once they relapse, there's not a whole lot of options. Now there are also antibodies developing in this space. So ER/PR positive hormonal therapy for this type of breast cancer, hormonal blockade is the mainstay. Their prognosis is good. However, even diagnosed in early stage, 20% of people may have a late recurrence, meaning 10 years after diagnosis. You guys are probably too young to know a Australian singer named Olivia Newton-John. I think in the late 70s, early 80s, she and John Travolta had a few films together. One is called Grease. At that time, it was very popular disco dance. So it's kind of a disco movie, dancing, singing. Anyway, she was diagnosed when young with early stage breast cancer. And then probably 10 years ago or so, when she was on a tour, singing tour, she developed low back pain. And bad news, cancer came back. This was probably like 18 years later. And she received more treatment, unfortunately, past few years ago. So if HER2 positive, they do need a HER2 directed therapy. And a triple negative, there's a lot Chinese herbs may be able to offer because treatment options are more limited. So once in a while, I will see some people who was just diagnosed with earlier stage breast cancer, and they want only alternative therapy. I have treated a number of them. However, my firm belief is if you're able to get rid of it, cut it out, cut it out. Those believe that cutting out cancer can help cancer cells spread. They say old housewife tale. There's no such scientific proof. You know, if operating on people help cancer spread, we shouldn't be operating on anybody. The fact of the matter, you can look at the long-term outcome. Early stage cancer, the cure rate may be 80%, 90%. You know, stage 3 colon cancer surgery alone, 50% cure. The problem is this, for me saying this, for any treatment, there's a duration of response, and then later there may be emergence of resistance. So I could treat, and I have treated earlier stage breast cancer, and I've seen some response. The problem is how long will they stay on the herbal therapy or alternative therapy or vitamin therapy, and how sustainable it is. I don't have any data. And then how soon will the patient develop drug resistance or herb resistance? Right now, I have another patient, it's an unrelated tumor type. She had a HPV positive GYN cancer. She was actually watched, surveyed by GYN oncologists periodically with pap smear examination. And then all of a sudden, she developed cancer on the vaginal wall, kind of similar to endometrial cancer. And that already spread to inguinal lymph glands. So it's more expensive, not a good surgical candidate. And she came, she had all the studies, but she said, I absolutely don't want chemotherapy. The standard recommendation in Western medicine is combined chemo immunotherapy. So she said she didn't want chemotherapy. She went out to look for alternative therapy. She had an intravenous vitamin C, hyperbaric oxygen, taking a bunch of supplement, ivermectin, fenbendazole, a lot of other things, usually a long list. And I saw her. I said, well, after 3 months, her repeat scan, we call it PET scan, showed a little tumor progression. Although clinically, she said, I feel better. A lot of people do when they change their diet, when they take alternative therapy, because a lot of them are anti-inflammatory. When the inflammation in the body is down, people do feel a little better. However, the PET scan shows mild tumor progression. At this point, I suggested another thing I will mention later too, called a mistletoe injection. This is a popular alternative therapy in Europe. By adding mistletoe injections 3 times a week, 3 months later, she had another scan that shows tumor shrinkage. And I just talked to her recently. I said, well, what do you want to do long-term wise? She said, I just don't absolutely want chemotherapy. I said, okay. She still have another scan. I said, I suggest you continue mistletoe. When she's on so many treatments, it's hard to say when tumor did shrink a little bit, which one is doing what. But also unknown is how long she need be on those alternative therapy and how much is the cost, whether it's sustainable or not. But with immunotherapy, I said, even locally advanced, you know, there may be 20% long-term survival. She didn't want to hear that, so I still have work to do. Okay, general principle, how TCM treat breast cancer. Cancer is a mixture of Xu and Shi, deficiency and excess. So which part is Xu? Most commonly, kidney, spleen, liver. We rarely run into lung deficiency and heart deficiency, not to say we don't see those in TCM. And again, the importance, the yin deficiency or yang deficiency, like I mentioned. And the Shi symptoms, talk about blood, qi stagnation, heat and toxin, phlegm, excess, those kind of things. And I would say that I actually rarely see people with a heat toxin manifestation anymore, because most people come to me to have received the modern Western treatment. They're already kind of weakened, have some treatment-related side effects to some extent. The herbal mix of immune boosters and anti-inflammatory. It's important to take into consideration stage of cancer. The early stage cure rate is actually very high, maybe 70, 80, 90%. We're really mitigating side effects of Western medicine. A lot of people, under a lot of stress, sleep disturbance, anxiety, appetite issue. Some people may have nausea and peripheral neuropathy and GI disturbance. In the late stage, try to maintain quality of life and prolong life. Post-op, try to minimize blood movers and delayed wound healing. I could use acupuncture and some herbal formulation to help speed up wound healing. The reason to minimize blood movers in the immediate post-operative stage is afraid of bleeding complications. During chemotherapy, there ought to be more tonifying herbs because people get weakened by continued chemotherapy. And radiation usually produces toxic heat. We need to pay attention to tonifying and heat clearing herbs. And there are also side effects from hormone blocker like aromatase inhibitors, like letrozole, Arimidex, endocrine therapy, endocrine manifestation, and bone strengthening. So some people may have musculoskeletal complaints on aromatase inhibitors. I often ask the question, and also want to share that with you. Ask your patient. Some of them actually know. What is your weakness? I will share you quickly a few case studies. So Lisa, I have been seeing her for probably 8 or 9 years. Started with just house maintenance, and she was diagnosed having stage 2 breast cancer. She had a triple negative breast cancer, so she's not on hormone blocker after initial chemotherapy, surgery, radiation, lumpectomy. She has a high-ranking job in a local bank. She has to travel a lot, so under a lot of stress. And every time she comes for the last so many years, the right pulse is always weak, the right one especially. And her complaints always been stomach bloating, not real diarrhea, constipation, but just the bloating and fatigue. So I look at the herbs I gave her over the years, always the tonified spleen, 保和丸湿皮饮六君子香砂六君子汤 mixture, also plus some 黄芪党参. Her blood pressure is normal. When you give people 黄芪, be very careful. People have high blood pressure. They say I'm tired. If you give them 黄芪, their blood pressure may go up, may become dangerous level. So this brings up the question I asked before, what's the patient's weakness? I believe there's also, each person may be predisposed to certain type of weakness. In other words, what type of person you are, the moment you were born, okay? Talking about the 5 elements, wood, metal, fire, water, and earth. If earth is too strong, earth is too weak. If the earth is too weak, you may be more prone to have abdominal bloating, bad digestion, diarrhea, spleen deficiency, that kind of thing. If the wood is too weak, you may be more predisposed to liver wind type of symptoms, dizziness, vertigo, nervousness, not sleeping well, waking up early, those kind of things. So also look at the patient. There is a doctor, famous Chinese medicine doctor in Nanjing Chinese Medical College, named is Huang, both Huang, but in Chinese character, different Huang. Anyway, he came up with this Fang Zhen Ren. Fang means classic formulas. Zhen means symptoms, complex, or syndrome. But the third element, triangular shape, is Ren. What type of person? Based on the facial expression, complexion, based on the body habitus, and based on simple questioning. What type of person more likely to have what type of illnesses? It's a very interesting way to thinking. Okay. Next patient, 72-year-old, stage 4, ER/PR, breast cancer spread stage 4 to the liver and spine. Minimal tumor volume, even metastatic. There's one spot in the liver, but her oncologist talked her into having some chemotherapy. So she came to me during chemotherapy. But it's quite interesting. She's lived 6-7 years. That's a long time on anti-hormonal therapy. And she said most of the time, for the most part, cancer was controlled well. But whenever there's significant stress, for instance, passing of her mother, and then somebody cheated in her business, disease progress, suggesting there's a link between stress level or inability to handle stress and the immune system and disease progression. But what's so striking is in the initial encounter, the consultation, she did most of the talking rather than me. Most people come ask a lot of questions. They want to know answer. They want to know what I think. But she kept talking about herself, her treatment history, what she's done in her life, all the accomplishment, and how her one business partner cheated her. She was very bitter. So it's clear that she needs more relaxation, meditation, and treating the Chinese medicine liver. So I give her acupuncture and share with her some breathing relaxation, concentration meditation. And another patient, Barb is a pharmacist. I've known her for 40 some years. Her husband then was a medical student. Later, he became a plastic surgeon in Cincinnati. Barb is a pharmacist. Unfortunately, she was diagnosed a few years ago, stage 4 breast cancer. When she first came to see me 3 years ago, she already had a diagnosis for over a year. She's undergoing treatment. She has estrogen receptor positive breast cancer. So she's on aromatase, which blocks the synthesis of estrogen in postmenopausal women, plus something called Ibrance. We talk about cell cycle regulator. And this medicine drug blocks the cell cycle regulators to stop the cell cycle, causing cell cycle arrest, stopping cell cycle progression or cancer growth. She did have a lab pleural fluid, which is non-malignant, that was tapped. And there's cancer in the liver, but not large volume. When she came, she's on some medicine. This everolimus is related to sirolimus and also the rapamycin, but much stronger. She had a lot of symptoms when she came, complained of a lack of appetite and weight loss. I gave her acupuncture, the herbs, and the mistletoe. And then she got a second opinion at Mayo Clinic. They said, well, get off of everolimus and adjust her medication. And then she's on something, continued on Faslodex and some other medicine. And then she kind of turned a corner. She feel better, gained some weight, very well, practicing weekly Taekwondo, even with stage 4. And she did also have some treatment for the pleural effusion called a pleurodesis, putting some chemical to cause scarring to obliterate the pleural space. She's done very well for 3 years, getting Chinese herbs, mostly for immune boosting, a little bit Tingli dazao to treat the pleural effusion. Good quality life, able to travel, taking care of children and grandchildren. So this is one of many examples from the Taiwan National Health Data Registry I mentioned. A total of 729 patients. So this is from a 10-year period of time, and they narrow down to whoever got taxane, which is Taxol, one kind of conventional chemotherapy very commonly used for breast cancer patients. So 729 patients, including the study, like I mentioned, part of them, small portion, 115 patients, also had a TCM, Chinese herbal medicine. 614 patients did not use TCM herbal medicine. Follow-up, because the advanced stage, follow-up was relatively short. So in the 10-year period of time, they applied some statistical analysis. You can see that the hazard ratio is 0.55 being in favor of the TCM users. In other words, their risk of dying is markedly reduced. And they also mentioned that there's some analysis what kind of herbs are used. 白花蛇舌草、半枝莲、黄芪, most commonly used as single herbs. And again, these are their analysis, statistical analysis, mining the data. So there are some single herbs, there are some classic formula, but that just relate more to my practice and what I'm able to do. So Jiaowei Xiaosan is a classic formula that pacify the liver, and actually also liver and the spleen too. Puguin, the single herbs, we use a lot. Dandelion, basically, use a lot for breast cancer or breast diseases, benign and malignant. And then we have 百花蛇舌草、黄芪、丹参、salvia, blood mover, 香砂六君子, this is for spleen, tonify the spleen. 鸡血藤, blood mover, 半枝莲, 桂皮汤, another formula for spleen, 半夏. Of course, with your training, you know, it doesn't mean the next patient you see, you should prescribe Jiaowei Xiaoyaosan. The symptom, the syndrome, the pulse, patient's complaint have to match. That's how you give out Chinese herbal formulations. So there's another study called a meta-analysis. They studied, I think they studied like 8 randomized trial. They searched the literature, they found many studies, and they have certain inclusion criteria, and they did a meta-analysis. And they searched the database like PubMed, Cochrane, AMAT, all 4 stages. And in the advanced stage, the survival is better in terms of CHM or TCM herbal medicine users. But one thing is clear that there's no harm reported. And this is what most oncologists are concerned about. If you take herbs, you take Western medicine treatment, you know, is there any contradiction? They cancel out each other. There's no harm reported. It's a pretty large database. So the big data, we do have seemingly some big data, but that doesn't mean, you know, we got to vindicate it. There's a lot more work to do. So there's still a significant knowledge and evidence gap. And ultimately, what we need really is, like I said, difficult to do, but there should be some effort toward that direction. It's a randomized clinical trial, prospective randomized trial. So do we still need a syndrome differentiation? In recent years, there is the emergence of a lot of Chinese herbs as a single ingredient, like capsules or pills. For instance, berberine. Berberine is from Chinese herb Huangbo, and also Huanglian has some berberine in it. And a lot of naturopaths, functional medicine doctor, even chiropractor, they all give their patient berberine. And you read the research, berberine has a very strong anti-inflammatory property, and in basic cell line research, it induces cell apoptosis to stop cancer cell spread. So if you don't know, if you never went to Chinese medical college, and you're practicing holistic medicine to treat cancer, you can put together a few like a huangqi, which is present. You can get that as a single herb. You can put together some resveratrol, berberine, or you can even get the 白花刺蛇草半枝莲. Then I'm sorry, I'm making you feel sorry for yourself. Why did you go to Chinese medical college to learn Chinese medicine? Okay, you don't need to learn that, right? So what differentiates us from those practices is syndrome differentiation. I insist that this is most important. And the ultimate use is you combine single herbs with classic formula depending on the patient's manifestation. Like I showed you before, patient has yin deficiency, patient has yang deficiency, you need to detect that. That's important. Okay. A lot of people are concerned about the toxic side effects, but quick to mention, remind them those makes toxin. First thing toxicology is those makes toxin. In the Chinese medicine, when we use the team approach, every player is present in small quantity. They work more in a synergistic fashion. And of course, you have to study. So this is another paper also coming out from Taiwan. Chinese herbal medicine improves survival in stage 4. This is from another hospital. They also mine the data from different period of time and larger sample size. Without going into details, I just showed a survival graph that looked pretty good. 5 years hazard ratio 0.45. Those who use TCM herbs more likely to be alive at the end of 5 years. And certainly there's a definition, just taking one bag of herb, one bottle of herbs doesn't count. You have to use, over how many days, 120 days, 180 days. And those are the commonly used herbal formulation. 炙甘草汤、小柴胡汤、乌贝散、加味逍遥散、四逆散、小金龙汤、甘露消毒饮柴葛解鸡汤、导赤散、柴胡疏肝汤。So Taiwan's practice, because it's paid by national health, the practice is closer to how I do it. They will mix the classic formulas with single herbs. And they will write in the computer as a prescription, and the pharmacy will dispense. They typically give people 15 grams divided into 3 doses. That seems to be a lot higher than what we do here. But I was told that because of the payment is not that good. They probably use a lot of filler, like a starch. That's why they use a higher quantity. In contrast, I have also read a lot of literature from China. The Chinese practitioner, they came up with a lot of proprietary modern day formulations. Some of the components I don't have access, and they've also come up with some injectable forms of herbal treatment, which is not, we don't have access to. So I want to talk a little bit about acupuncture. This is before taking a break. This is a 40-some-year-old female I treated over 30 years ago. I just starting at that time, didn't know a whole lot about how to treat. So she came. At that time, they were still doing bone marrow transplantation for relapse breast cancer advanced. So she had a lot of chemotherapy, and unfortunately, cancer relapsed on the chest wall. It's visible on the breast and chest wall, and probably somewhere else, but not significant volume elsewhere in the liver and the lung. So she came, she said, I talked to her about more chemotherapy. She said, I had the strongest form chemotherapy under the name of bone marrow transplant. I don't want any more chemo. So I just used acupuncture. At that time, I didn't know a whole lot about Chinese herbs. I was just learning Chinese medicine. So how to treat? Well, we know the stomach energy meridian goes through the chest, and to some extent the liver channel goes to the nipples. So I put needles mostly in both legs along the stomach energy line, both above and below the knee, and also large intestine in the arms. Large intestine correspond to the stomach channel, and a few needles in the liver meridian, particularly liver A. A lot of needles each session, and she was coming twice a week. And interestingly, after about 6 weeks, and she told me there's a visible shrinkage. Didn't need any more scan. You just take a look, there's a response. And that response went on for almost a year. And during that period of time, she felt good. She traveled and even went to France. There was a place called Our Lady of Lord. There's a spring, supposedly the spring waters, the healing, produce miracles. And eventually, cancer began to grow. It's interesting. It's like cancer cells also develop a resistance to acupuncture. Okay. But this is one anecdote. There's very little experience I can find people using acupuncture treating breast cancer alone. And this is an exceptional case, anecdotal case. But she did well for a year, and then disease progressed. She had some treatment, not under me, passed probably a year and a half later. To live 1 year and a half with advanced breast cancer with reasonably good quality of life for a year, not too bad in early 90s. So what are the points I use? I use the 4 1, 2, 3, Master Tong's point. There are also some points, 环潮 and the ear point. And there is a chest or breast in the ear acupuncture. So this is a 4 along the stomach energy line, kind of corresponding to stomach 32 or 浮兔in conventional points. It's kind of in the middle of the thigh, but it's along the stomach energy line. If you poke around, the middle point is called 4马中. It's actually tender. And it's 3 trim above and 3 trim below. I'm sorry, 2 trim above and 2 trim below. It's a 4马中, 4马下. The 3 points combined is very powerful. I use them a lot, not just for the breast cancer, which is actually very rare. For respiratory symptoms, allergies, skin disease, it is corresponding to, through probably correspondence to the large intestine and correspond to the lung. But again, interestingly, you think about the stomach energy line goes to the chest. So actually, lung energy meridian itself, all the 12 points are on the outside. It's probably more for upper respiratory problem and a skin disorder. There is a branch that's go into from lung 1 to the lung. So the stomach energy line probably treat the chest disorder more effectively, which you will see more. Another 3 points I use a lot is the 三重. The 三重 one is corresponding probably well to GB39. Chinese name is 玄中. And then above that, 2 chun and 2 chun, 三重 1, 三重 1, 三重 2, 三重 3. The 3 points about combined is kind of pan-tumor points I use a lot to treating cancer patients. They are really close to the gallbladder line in the leg. And then on the outside, posterior to the fibula, it's a 三关 1, 2, 3. And that's also combined kind of pan-tumor points. I use them a lot. And there's also 妇科 and 环潮. I won't go into detail. That's for breast cancer too, for a lot of female problem gynecological disorders. The Chinese word for metastasis, depending on the sites, some people on the table I saw quite interesting. We use the jigen a lot for lung disease, cough, and throat discomfort. 位置, 黄芩, 麦冬 for lung. If the brain metastasis used a lot of wind medicine like Scorpio, 全蝎, 蜈蚣, 天南星, 枸杞. Okay, I won't go into all the details. Okay, we'll take a break.
All right, we'll take a 10-minute break and then we'll get back